One of the best opportunities to do a clinical residency in a major academic center is to have some involvement with research. So you can really see how research can add to patient care, and likewise how specimens from patients can add to research. And so that connection between clinical work and research is really critical.
We put the patient in front of everything that we do, and I think that the people who are coming through the programs and who are training see that in a very demonstrable way in how we think about our research questions and, of course, how we approach then caring for patients who are in research trials.
What really stands out is the fact that there are no silos at BI. People are interested in science and mentoring and collaboration, and it really flows seamlessly, and there are very few barriers to collaborate.
Within the Department of Medicine at BIDMC, we heavily emphasize an individualized approach to resident research and to mentorship. We have certain residents for whom they come in confident about their choice of subspecialty, and our goal is to pair them with a research mentor that is within that subspecialty and to help them pursue the projects that they're most interested in, which will ultimately allow them to develop a great career and match to a fellowship. We have other residents who may not want to specialize and may not be aware of the opportunities within research. Therefore, we find that our one-on-one meetings with residents can be very helpful in pairing them up with a diverse list of potential faculty members and exposing them to the different types of projects that can be pursued.
We're just one laboratory in a broad group of investigators in cardiology. We span everything from fundamental basic science research to population-based research, large data sets, outcomes research in cardiovascular disease, in data sets that might include individuals across the whole United States. So there really is the entire gamut of investigation available in the cardiovascular division.
There are trials for patients with the different blood cancers that we take care of: leukemia, lymphoma, multiple myeloma. Some of that work is in immune-based therapies, some in targeted therapies.
We look at all aspects of immunology, viral and microbial pathogenesis, as well as the development of interventions to try to cure and prevent diseases, such as vaccines and therapeutics. We've worked for many years on different pathogens of global importance, including HIV, Zika virus, tuberculosis, influenza, in the last 2.5 years, COVID-19, and now also monkeypox.
One of our fundamental responsibilities is to get people excited about what we do, and we know that these first exposures can sometimes be sort of life-changing in terms of setting people off on a course for their future careers. And so we offer residents really the opportunity to spend time in our lab. They have specialized research rotations that they can do focus work, but also have a broader exposure to what we do, coming to our clinical trial meetings, learning about how we work with the FDA and the other advisory groups that go on in terms of developing these strategies, and having a broader exposure to our patients who are going through these therapies. So we really can give them the whole experience from the lab into the clinic itself.
We also have a dedicated physician-scientist track. This is intended for our residents who come in with significant research background and who are interested in spending at least half of their careers in the future pursuing research.
There are numerous scientific opportunities within BIDMC. I think you'll find an incredibly scientifically interesting and welcoming, productive and fun experience.